Welcome, 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 and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because the more information you have, the more informed decisions you will make. And I am delighted to bring O.J. Rustad, and you are Advanced Dermatology in Vadnais Heights, White Bear Lake. I'm glad that you could join us again. It's so nice. We want to talk a little bit about this segment on psoriasis.
Correct.
So, so enlighten us.
Well, psoriasis is a condition that can be quite debilitating for some people. Some people can be quite mild. It can range from just a few scaly patches on their elbows or knees, or a little bit of scaling in their scalp. Sometimes the only manifestation is a little bit of discoloration or some scaling, pitting in the nails. So it can be rather mild. Some people, unfortunately, can be, their whole body can be involved. Wow. Scaling everywhere, they can't wear dark clothing, they itch, they're uncomfortable, they're self-conscious. So it can be quite debilitating, not only from a symptomatic, itchy condition, sometimes they will crack and break open and bleed, but also from a societal condition, especially younger people or people that have a lot on their hands, and so it's visible. And in this day and age with concern about communicable diseases, people that don't know what psoriasis is sometimes can give people that do have psoriasis some funny looks and some unusual questions. So people can feel quite self-conscious about their condition. Oh,
sure, because our first thing is, am I going to catch that?
Correct.
You know, with washing of the hands and things
Touching.
like that. Yes, exactly.
Sitting near them, that sort of thing. So those are concerns, but certainly totally unfounded. We don't really know why people get psoriasis, but it's not communicable. You can't catch it from touching somebody else. It seems to be hereditary in about half of people, so some people just get it for no good reason.
Wow.
And psoriasis not only can affect the skin, but some people can affect their joints as well. The same sort of condition that you can see externally can be going on in the joints, so they can have stiffness and aching and that sort of thing there as well.
Well, us being from Minnesota, we get chapped hands. I mean, that's even uncomfortable.
Correct.
Because they can get to the point of bleeding, and you know.
Absolutely.
Then you put more lotion on, and then it gets in there, and it hurts even more. So I can't even imagine how much pain they are in just externally.
Absolutely.
Let alone knowing what they see inside. So I guess. Are there different forms then? You talked about, you know, the whole idea of maybe having it on your hand versus your face, and then it's external. There's not really a good way of hiding that. You know, we can wear a lot of clothes. But are there different forms then on that extent of psoriasis?
There's the most common, the plaque type, which is just the big, thick scale. Some people they may itch, some people they may not. Some people get an erosive type. There can be inverse psoriasis, where it infects kind of the opposite areas. Instead of the external surface, is more the groin or the arms. Underneath the arms. That's not a very common, typical sort of type. Another type is something called guttate psoriasis, and that's very small, scattered patches, and that very commonly, typically occurs after maybe a strep throat infection.
Oh.
The good news for people that have the guttate, the small type of psoriasis, is that a lot of times after their sore throat, their infection's been treated, or it goes away, if it was more of a viral sort of process, over time, and it may be months, the guttate psoriasis may dissipate. So it may not have the chronic, long-term, debilitating tendencies that the plaque type may. And some people just have psoriasis of their palms and soles.
Oh.
And as we talked about, you can imagine how that can be trying to walk if your heels are thick and cracked, and it can be very uncomfortable and debilitating.
Right. Very much so. I don't even think you could get an insole that would actually take care of that.
No, it wouldn't be enough, because the whole sole can be affected. And then it also sets up once your skin barrier has been breached for infections of all sorts, such as bacteria, such as fungus, yeast, lots of different things. So not only can have the debilitation of the cracks, but also if you get an infection, that can add to the the problems. And then it can spread up the legs and even be more serious.
Wow. So how is this diagnosed then? You know, actually knowing if you have it?
Well, there's several ways of diagnosing it. A lot of times people will come in saying their family members have had psoriasis for years, and you look at their skin and they've got the typical thick, scaly areas, and you go, that looks like psoriasis, and you start to treat it as psoriasis, and it responds, and you know that it's most likely psoriasis.
Okay.
So just observing it, you can have a pretty good idea. Sometimes people that have just maybe involvement to the palms and soles, or it's not as classical, not as the usual sort of look, you may biopsy it, which is where you actually cut out a little plug of skin and you send it off to the pathologist, and they look at it under the microscope and they can tell you, is this psoriasis or is it a different type of skin condition, dermatitis, an infection, that sort of thing. Because there are other conditions that can look like psoriasis, and so then that can help distinguish if there's some confusion about the diagnosis.
Okay, does this hit a certain age group, or can you have it at any time?
You can have it at any age. It's not as common in children or teenagers. We see it generally probably later, 20s, 30s, and then later in life.
Oh.
So it's not, it can be seen any time in a person's life, but more typically later in life.
Okay. If we do come in and we do have it, or you have diagnosed us with it, is there something that can cure that for us?
You know, unfortunately, we don't really understand why, number one, why people get psoriasis, and it's probably in their genetic makeup. And because it's in their genetic makeup, and at this point we can't change their the genetic makeup, we can't cure a condition like that. But our hope is that we can give people treatments, modalities, means of being able to control their symptoms, make it not so scaly, not so thick, not so uncomfortable, help with infections, that sort of thing. And since you can't cure it, a lot of times people need to be on maintenance therapy.
Okay.
So you try to use topical medications or some systemic medications, either tablets or injections, to try to control the condition. Certainly we try to use the least aggressive amount of medication that we can to control it for a person. And sometimes people go through episodic flares. Just like a lot of skin conditions, things can worsen certain times of year. Sometimes winter is worse because of the dry air.
Oh.
Sometimes it's better in the summer because of the humidity, and the ultraviolet light can be of some benefit. Some people that doesn't help, and sometimes it actually makes it worse. Their skin sweats, and so that seems to irritate their skin.
Wow. So you just try to give them back a quality of life, try to make them as comfortable as you can. And
try to give them the tools to make
yeah.
life comfortable for them.
Right. To benefit themselves. Yeah.
Exactly.
Exactly. That's great. So, you know, when we're talking about the tools, we need to kind of follow up with some maybe treatments.
Correct.
And can you tell our viewers maybe what some treatments that advanced dermatology may offer them?
Sure, absolutely. So again, it kind of depends on what sort of psoriasis you think a person has. Is it the guttate psoriasis that flares after a person's had strep throat? Obviously, you want to make sure that they've gotten their infection taken care of, and then deal with the underlying cause first, and then deal with the psoriasis generally concurrently, so that hopefully as their infection gets better, their psoriasis gets better. So hopefully once their infection is gone, their psoriasis is already on the way of getting better. So routine medications, sometimes just over-the-counter topical emollients can be helpful. Things that have lactic acid or salicylic acid, things that slightly take off the top layer, that thick scale that develops, something that will bring moisture back to their skin, hydrate their skin. Other topical medications that are available over the counter are the hydrocortisone ointment that may be available, and that can be quite helpful. If those things aren't helpful, then prescription medications can be helpful, and it ranges from something like a topical steroid to a prescription strength salicylic acid, urea containing compounds. And sometimes those compounds can come in rather novel ways of applying them in a vehicle. Typically we use an ointment, and the ointment is helpful because it hydrates the skin. It holds the moisture into the skin.